I figured out how much they're suffering because of the standard Indian vegetarian carbohydrate loaded diets that they're having. Unfortunately, our guidelines tell us to start them on statins, but then if you look at the lipid profiles, they're absolutely normal. They're like, oh, we eat healthy foods, we eat only vegetarian food. I'm like, but why don't you eat meats? They're like, because it's bad for you. So nobody from the medical field actually talks to them regarding this. Diabetes in India has been documented since thousands of years. Per capita consumption per year is about 3 to 5 kilos in 2024. The numbers are definitely skewed in terms of the number of unhealthy people in India. As you grow older, you've got to become weak, you've got to become frail, you've got to be careful that you don't bump into something and fracture your hip. You don't have to become frail when you grow old.
Hey folks, it's Dr. ShawnBaker here. Hey, if you or someone you love is suffering from chronic disease and you're tired of just managing symptoms with potions, pills, and procedures, I want you to check out Revero.com. Our team of dedicated professionals is committed to tackling the root cause of your issue and finally getting you healthy. Hurry up though, our spaces are filling up very quickly. Okay, so we're going now. So I'll start out introducing you and then we'll just go from there. So anyway, welcome. Today we have with us Ankur, who is from, I guess you said New Delhi, India. Long part of the world, and kind of an unusual place for a carnivore success story, although less unusual than you might think. But anyway, I guess maybe just give us a little bit about yourself and we can go from there.
Yeah, so like you've already mentioned, I'm in India. I am an emergency physician over here. I'm a trained emergency physician. And my carnivore journey is about 2 years old. When I turned completely carnivore. Before that, I was doing low-carb keto for a year when I had actually realized that my triglycerides had hit 600. This was in 2021, July. And I had no idea about TG to HDL ratios at that time. But then I figured, my carb intake was really high. I've always enjoyed my meats. I used to eat meats once or twice a day, every day for sure. But then, that was always accompanied with carbs. So I thought, the carbs are hitting my triglycerides. And I was 86 kilos at that time. So I removed all my processed foods, my junk, the carbs, the sweets. Yeah, and then about 8 to 9 months, I lost about 21 kilos. But through the time, I started reading up more on nutrition because as a doctor, I actually realized I had no training in nutrition. And I knew that is what was wrong with me. And I came across Robert Lustig's book, Metabolical, and I understood metabolic health much better then. So if I look back, my TG to HDL ratio at that time was 16, and currently it's at 1. So 1 year through with the low carb, not even 1 year, about 10 months. So 2022 April, I came across your podcast with Joe Rogan, and somebody sent me Paul Saladino's reels when he was still a carnivore. And I was like, I have always enjoyed my meats. This actually makes a lot more sense. So I just, went into carnivore cold turkey. And there's no looking back since then. And then I've realized over the last 2 years how metabolic health is actually linked to emergency medicine also, because we get a lot of patients. And I figured out how much they're suffering because of the standard Indian vegetarian carbohydrate loaded diets that they're having, and trying to raise more awareness regarding nutrient dense foods. I've seen a lot of changes in myself over the past 2 years. Even after I lost 21 kilos, I had inflammation on my face, which I could notice. I still had symptoms which I did not know were symptoms at that time, but when I went full on carnivore, those symptoms disappeared. And then I realized, yes, I had those symptoms. So, in short, that's my story.
Yeah, I mean, you're there obviously in the capital of India. A lot of people there. It is, as you mentioned, it's a vegetarian-based society. Although most people, I do think, eat meat. I think the majority eat meat, but it's a very tiny amount relative to, say, other places like, compared to Australia, the U.S., and other countries. And in some places, meat is stigmatized. I think there's some places where beef is kind of illegal. Correct me if I'm wrong. Maybe in the some of the northern regions, I think. And so, as a emergency physician, you went through your medical training. Was there a belief, even though you didn't get much nutritional training, that meat, saturated fat was problematic and we should be limiting that? Is that what's taught to most physicians there?
I don't think we're taught any of this, we've all heard about it, It's come down the generations, from probably family, from media, from everywhere else. I used to have my meats for sure, but then the advice that I would actually give out was what the dogmas and the myths that have been going around, like have your fruits and vegetables, have cereals and grains, cut down on your red meats because your cholesterols are going to go up. But yeah, unfortunately, that is what we've done through our careers. But I'm trying to reverse that now.
So obviously, I mean, what I find with most physicians that are skeptical, I think for most people, even to recognize that nutrition has an impact, they have to experience themselves. That was my experience. Almost everyone I've talked to has at first kind of said, "Wait a minute, I'm not as healthy as I could be." Tried diet, got it's often a phenomenal result, and then they go on to sort of try to apply this to your patients. Now, as an emergency room physician, obviously you're treating acute crises primarily. Probably most of them are exacerbations with underlying chronic disease, chest pain, diabetic complications, respiratory complications, all those things are probably a majority. And then I'm sure there's some trauma as well. But how much opportunity do you get as a fit physician in India to interact with your patients with regard to nutrition? Is there any direct interaction you can say, hey, look, if you didn't, you wouldn't be in the ER with, diabetic infections if you did this or that? How does that go for you?
So it's actually, I was actually quite surprised that a lot of people were receptive to what I was talking about. I started taking out data. So I looked at retrospective data about 6 or 7 years of all the MIs and the strokes that had come into my department. And, I discussed it with some cardiologists and neurologists. And I'm like, unfortunately, our guidelines tell us to start them on statins. But then if you look at the lipid profiles, they're absolutely normal. And there are most of them where lipid profiles are not even done and we're still starting them on statins. So, why are we doing this? Not even recently, last year we started off a research in my own department where we're doing a prospective survey. It's like a 32 questions survey where we have the dietary patterns. It's not food frequency, but then, vegetarian, vegan, carnivore, for anybody who's coming in with documented metabolic disorders or coming in with acute conditions like heart attacks and strokes and diabetic ketoacidosis and all of that. And we saw that, 63%. So we've collected data for about 7,000 patients till now. And 63% of them are pure vegetarians, and the rest, 33%, 34%, who eat meats or eggs or fish, eat them probably once or twice a week or once or twice a month, and then 85% do not smoke, 65% don't drink alcohol. Most of them have Nova processed Nova Group 1 foods, which are mostly unprocessed. So, we started to see this trend. It was like a matrix opening up for us, and a lot of these patients are like 25, 30, 35 years old who've been having pure vegetarian foods. So when I used to go ask them that, are you on any medications, are you diabetic? Like, yeah, we're diabetic, we're on medications, we're on this and that. I'm like, okay, and what do you eat? They're like, oh, we eat healthy foods, we eat only vegetarian food. I'm like, but why don't you eat meats? They're like, because it's bad for you, And then the question and answer start, right? And like, you should eat your meats and your eggs and your fish or dairy if you want. And they're like, why would you say that? And once I see that there's a spark of interest, the family members actually come up and we have like a quick 15-20 minute session together talking about everything. And they're also surprised that nobody from the medical field actually talks to them regarding this and how skewed medicine is, because it's in front of them. They can see what's happening to them or what's happening to their family member. And I'm like, okay, fine, this is what you've eaten for the past 20, 30, 40 years. This is where it's got you. What's the harm in trying what I'm talking about? Maybe don't go cold turkey, but taper down your carbs, cut it off, start increasing your nutrient dense foods, and see where it takes you. So it gives us a lot of opportunities, and I've started a few initiatives in our own department where the coffee shop can't get any added sugars along with anybody's orders. If I order coffee or somebody else orders a coffee from the barista, they can't get sugars in. Even if a patient or a family member orders coffee, they know it's my standing order, no sugars to be brought in with the coffee. And if somebody has a problem with that, it's escalated to me, and then we start having a conversation regarding the sugars. So we've got these touch points, and because of my research, my team members, my residents and all, they're also seeing how sick the population is and how sick their food is or their nutrition is. And they've also started to counsel the patients and the attendants regarding the correct way of eating. So yeah, we do get to talk to them and try and educate and raise some awareness.
I think the most interesting point you raised was you said most of these people are eating a majority of this called Nova Class 1 foods, which are not heavily processed. These would be whole unprocessed foods primarily. And despite that, they're coming in with all these diabetic complications. Is that what I heard you say?
Yeah, yeah. And for a lot of people, they believe that India became diabetic after westernization, but diabetes in India has been documented since thousands of years. From the times of Charaka and Sushruta, they've mentioned in their textbooks from like I think 600 BC or something, where they've written diabetes as madhumeha, which is sweet urine, and they've spoken about how cereals and grains can cause diabetes, and the remedy is actually having meats. And this is at that time, even in the 1800s, early 1900s, diabetes has been documented in the rice eating populations of India. So yeah, it's not just processed foods, but yeah, the whole grains and the carbs also have an effect.
Yeah, it makes you thankful that you're practicing at a later time because, you read historical accounts of physicians dealing with diabetes, and they were always tasting people's urine. And just sounds like something would be like, I don't know if I'd sign up for that job. I got to taste these people's urine all the time. So, yeah, I mean, it's kind of, I've read that, across all over the place, in Europe and other places talking about, treatment of diabetes. So obviously, you live in one of the most vegetarian countries in the world, per capita. There's a lot of, obviously there's 1.4 billion people, biggest populated country in the world. How, and some people will say, it's difficult because there's a lot of poverty, as you I'm sure you're aware, and it's just cheap food. These grains and rice are cheap food to feed the population. Do you see a viable solution for improving the quality of the Indian diet? I mean, I know it's probably a multifaceted, difficult solution. What are your thoughts on that?
Yeah, we've got abundance of meat for sure. The availability is there. The consumption is not there. I mean, per capita consumption per year is about 3 to 5 kilos in 2024. That's it's disastrous. Compare that to Hong Kong or some other countries where they're having 100 kilos and all, and our life expectancy is also 67. But I've had a few patients, who were not very well off, and they came to me with diabetes, and I gave them two options. You go to a normal endocrinologist, and he or she will have to put you on medications, and you'll have to keep consuming carbs along with that, and it's going to cost you this much, and your A1C is not going to come down from 11 to normal levels. They'll keep it probably above 66.5 or 7, and they'll think that you're having good control, or try the carnivore diet. And he did. He could get fish, eggs, and red meat, mutton for not a lot. And in about 1.5 months, his A1C from 11 came down to about 5.4. And he was really happy, and he was really enjoying it, and he could afford it. That's the main thing. He could afford it. So people think that carnivore is going to be really expensive, but the good thing is, you're not going out grocery shopping. You don't have to think too much. You don't have to buy 10 vegetables and lots of fruits and cereals and grains. So you save a lot over there, and then you get into the meats and the eggs. So I don't think it's I mean that there's a problem in buying meats and consuming them in India.
As you probably know, India has really the greatest number of heart disease in the world. Obviously, because of the large population, you have a lot of heart disease patients. You got a lot of diabetics. I think something like 11 to 12% of your population is now diabetic, and I'm sure you have millions and millions of heart attacks every year in there. I don't know what the smoking rates are in India. Are they high, or what are they? Do you know what the population average for smoking rates are?
I'm not exactly sure about the smoking rates, but yeah, I do know that there are a lot of smokers for sure. And 11 to 12% of diabetes in India was, I think, published in the Lancet, but which I think is quite a gross underestimation, because about
Really?
just about 10 to 15 big hospitals in India actually publish their data, and we've got 10 to 15 in just the vicinity of where I work. And we're a huge country, like you mentioned. We have a huge population. Just the study that I was telling you, that the one that we're doing, the 7,000 people who've entered the survey, the number of diabetics in that group of patients is 50% of 7,000 and 28% of my total footfall. These are the 28% who've actually entered the survey, right? And then we've not included the ones who did not want to be in the study. We didn't include the ones who were brought dead on arrival. We haven't taken the ones who do not have documented diabetes or might be pre-diabetic. So our numbers would go easily above 30% for the ones who are suffering from diabetes, right? And this is just my emergency department, right? We've got the OPDs also running, where we'll have more data coming in. And then if you just combine the data from all over the country, it's going to be massive. 70% of India is actually overweight and obese. So I would easily say 40%, 45% of the country has diabetes. You walk around anywhere where they've got huge visceral fat, pot bellies walking around everywhere. It's unfortunate, but yeah, it's happening, and it's become it's become normalized, right? People just walking around like that, and that's like the new normal. It's good to be fat. So the numbers are definitely skewed in terms of the number of unhealthy people in India, especially the
Well,
diabetic.
and you point out, as you probably know, that you see diabetes occur much more rapidly with less weight gain. You don't in America. You have these enormous morbidly obese folks that are,
Yeah.
150, 200 kilograms, and in India, just a little bit of extra, maybe an extra 10 kilos, and all of a sudden you're diabetic. And I think there's a genetic predisposition. But it's interesting if you're saying that 70% obese or overweight, which is mirrors the United States. And as you mentioned, in India, it's a tiny amount of meat, 3 to 5 kilos. In the U.S., it's about 100 kilos. So is it the meat driving the diabetes, as some people would say? Clearly, India would be a very excellent example to say, no, it probably isn't. Now, the critics would say, well, it must be all the dairy products or the eggs or something along those lines. But even still, I think, do you have data on what is the overall composition of the Indian diet on a population level? How much is carbs? How much of it is different
Yeah.
things.
Yeah, I did this with Richard Smith once, and the Indian Council of Medical Research actually came out with the food plate, with the Indian food plate. And when I looked at it, I'm like, this is nothing new. You've asked us to have cereals and grains and legumes and fruits and vegetables, and some milk and nuts, vegetable oils, and a little bit of fish and meat, which is like probably not even 10%. So the recommendations are completely carbohydrate based. You go anywhere in India, your breakfast starts with carbohydrates. You go south of India, you might have heard, you have idli and dosas and vadas and all of that, made of rice and pulses. And then you go in the west, there's something called poha, which is again rice based breakfast. You go north of India, there's a lot of parathas and rotis and chole bhature, which is all refined flour and a lot of rice based again. And then you go in the east of India, there's a lot of rice and potatoes start off as breakfast. So that's the Indian breakfast for you. Anywhere in the country, it's all carbohydrate loaded. Even if you have lunch and dinners, it's going to be some rice and vegetables and legumes and pulses. And again, those who do have meats, even I used to have my meats and I used to have them with a lot of rice, although I would have a lot of meat also, but then I would have a lot of rice along with it. So it's definitely carbohydrate loaded standard diet in India, for sure.
And then obviously protein is a problem.
Yeah.
I would say that the average Indian probably gets far lower protein than they probably need. I mean, do you have any idea what the I mean, the USRDA is 0.8 per kilogram, which many people say is ridiculously low. Any thoughts on what the average Indian is getting as far as protein
It's going to be
nourishment?
really less, Sean, because most of the vegetarians don't get the bioavailable, biodigestible, essential amino acids in the right quantities, right? And they won't be touching zero point 0.5 grams per kg. Also, I'm 110% sure about that. I mean, because if you look at cereals and grains, all of that, more of carbohydrates, and not much of your essential amino acids in them. So protein deficient, we have a lot of geriatric population, really frail. We're starting off another study regarding sarcopenia and diet preferences, and then the patients who are coming into my department, with trivial falls and they're fracturing the bones. Again, that's become actually quite normal for all of us to think that is the circle of life. That as you grow older, you've got to become weak, you've got to become frail. You've got to be careful that you don't bump into something and fracture your hip, or your wrist, or any other part of your body, when you can actually have better lean muscle at that in that age. You don't have to become frail when you grow old, and that can be avoided with the right nutrition before that, and getting the right amounts of proteins and doing your exercises. So, we're looking into that. Yeah, I mean, we all know we can't do a randomized control study, can't do control group with a carnivore based population, because this is India. First of all, you're not even going to get as many patients as the vegetarian population. But yeah, I mean, we are looking at things, and people are actually waking up. I've had conversations with neurologists who've actually told me that, we understand high dose statins is not good for our patients, but we still have to give it to them when they have acute strokes, because it says in the guidelines. I mean, if we don't give it to them, we can easily get sued by somebody. So, lot of things are happening, but I'm happy that people are receptive. A lot of people have actually asked me, have I got any blowback yet? I haven't. So that's a good sign.
Yeah, and so I mean, it's interesting that you're actually collecting data on your population, your diabetic population, your sarcopenic, frailty population, and seeing what those dietary patterns are. Not surprising to me. I mean, it doesn't surprise me at all what you're finding, quite honestly. But what about, I mean, there obviously the whole thing about the statins. I mean, clearly, what we start to see as people go low carb in general and they rely more on fat, we often see, it's particularly if they're lean. I mean, I think lean is the big distinguisher there, that their their cholesterol will rise, total LDL, ApoB. What are your thoughts on that? And I mean, when you're seeing ER patients with heart attacks, are they always having massively elevated cholesterol, or do you even look at that?
No, they're not having any elevations in their cholesterols. So again, I've tried to publish a couple of case series, still getting rejected, where we've seen cholesterol levels to be low or normal, and patients are having heart attacks and strokes. And these are patients with no comorbid conditions and non-smokers. And it's not just that. What we've also started to do is send the B12 levels and homocysteine levels of all these patients who are coming in with thromboembolic events or cardiac events, right? And we've actually noticed another trend. Most of them have B12s in double digits and homocysteines in triple digits. Now, you also would know that high homocysteines are a cardiovascular risk factor, that makes your blood clot anywhere in your body. And we're seeing this with stroke patients and heart attack patients. So, I've done a few content on my Instagram also. We've had patients come in with heart attacks, absolutely normal cholesterol levels, but sky high homocysteine levels and tanked B12 levels. So, I mean, I asked my cardiologist this question as to, why do you think he had a heart attack? His cholesterol levels are normal. He's a non-smoker, has no comorbid conditions, no known comorbid conditions, but he's coming in with this B12 deficiency with really high homocysteines. Could this be a reason? And they're like, yeah, it could be.
You
So,
said
yeah,
you said, that's interesting. You're seeing people with either normal or very low cholesterol, high homocysteine, low B12, and they kind of reciprocally act upon each other. If you have low B12, you're likely to
yeah,
have high homocysteine.
yeah.
And I think the converse might be true as well. And when you try to publish that, why won't they? What are they saying? Why are they rejecting the paper? Is it
So
because it goes
a couple
against
of
the norm?
journals,
Or
yeah, a couple of journals didn't even find they couldn't find peer reviewers who accepted to review those papers. So yeah, it's in the cycle, and it's not just with in stroke patients. We've also found a connection with dysrhythmias like supraventricular tachycardia. So B12 deficiency has been associated with atrial fibrillations. But then it just struck me one day. I had this 26-year-old actually come in with a heart rate of 200. And again, he had no comorbid conditions. His sugars were absolutely okay. His blood pressure was fine. And, we reverted his supraventricular tachycardia. And I asked him, "What do you eat?" And he's like, I'm a pure vegetarian." And then I just asked him, can I send a couple of tests for you? Because usually with SVTs, we don't do too many tests. So I sent his B12 and homocysteine, and I sent his lipid profile also. Now, obviously, vegetarians, as you would know, have a lot of plant sterols, so that keeps your cholesterol levels in check as per the medical science. So he had normal cholesterol levels, but his B12 was about 50. His homocysteine was about 100. And I asked the cardiologist, you are going to discharge him on medications, which is calcium channel blockers. But then we've seen a lot of patients actually keep coming back to us, even if they've been taking their calcium channel blockers. Why does that happen? And obviously, he did not have clear cut answer. Even I did not have a clear cut answer, because that's what we've been doing. We've been told SVTs, reverted, put them on calcium channel blockers, and they'll keep following up in the cardiac OPD. But then when I saw this, I sat down and told my team, the next 10 supraventricular tachycardias that you see, if they have no comorbid conditions, they have no underlying structural heart disease, send their B12 homocysteine lipid profiles. Let's take a look. And the trend was right there. They all had normal cholesterol levels. They were all vegetarians. They were B12 deficient, again, because they're all vegetarians. They're not going to get any B12s, and their homocysteines were really high. So I thought there is another trend to that, right? So yeah, I mean, we're looking at that. I'm absolutely convinced. Your body makes cholesterol for yourself. I got mine done today, and it came out to be 450, and my LDL was 350. I'm quite happy about that. My TG to HL ratio is just 1. I'm still getting my triglycerides down, because it was 600 at that time. It's 110 now. So yeah, pretty stoked about that. HDL is 91. So yeah, but these other patients. So we're doing a retrospective study and a prospective. The retrospective data I've already seen. Probably 3 or 4 patients out of 50 or 60 would have had cholesterols in the 250s, but they would also had the triglyceride to HDL ratios more than 2. And we're starting off a prospective study for the next 2 years, where we'll be taking in all MI patients, and we're going to take a look at the smoking status, alcohol, exercise, lipid profiles, and B12 levels, and see what that shows.
What is in the U.S., most people get their health care through an allopathic system. I know in India, I think there's probably like Ayurvedic type stuff. Like I haven't been to India, but I was near that region, and I went to an Ayurvedic practitioner kind of for fun. Somebody told me to go do it. And obviously they concentrate on different things. Does that make up a large component of people who get their health care? Is the allopathic system kind of reserved mostly for emergencies, and then most people manage other stuff in these other alternative things, or has India become fully westernized in its medical practice?
So I think what I've noticed is that when allopathy doesn't work, people go into the alternatives. So they go into Ayurvedic, they go for homeopathic, and maybe some other naturopathies. But usually the first thing they come to is the allopaths. But in the rural sectors, sometimes they start off with Ayurvedic, and if that doesn't work, then they go on to allopathic. Yeah, but in today's date, Ayurvedic is, it's seeing a boom in the industry. I'm not sure how well it works or it doesn't work. Can't say, but no, we all know how nutrition works. So yeah.
Hey folks, it's Dr. ShawnBaker here. Hey, if you or someone you love is suffering from chronic disease and you're tired of just managing symptoms with potions, pills, and procedures, I want you to check out Revero.com. Our team of dedicated professionals is committed to tackling the root cause of your issue and finally getting you healthy. Hurry up, though. Our spaces are filling up very quickly. I see the position where you're at and maybe there still is. I mean, there's a lot of financial interest and profit in medicine. And I think we kind of intentionally it's bizarre the way our insurance companies work now. It's like they make more money when healthcare costs more, because they're only allowed to spend a certain amount on administrative costs, including their salaries. And so the only way their salary goes up if the overall cost goes up. So it's kind of perverted in that regard. But I think, correct me if I'm wrong, because there may be more financial incentive to save money in India, and things like this, good dietary practices might be a good place to do this. And obviously you've got a lot of patients that you can probably get some data pretty quickly on. Is that a fair thought?
Yeah, I think something like this can definitely be looked into, because You're right. I mean, a lot of patients are suffering. We've got huge numbers, and and I was just thinking one day as to just because we have a huge population doesn't mean that we should have a huge sick population. We can also have a huge healthy population, but that's not happening. It's high time that people start getting the right advice. I'll give you a really interesting anecdote. I was asked by my hospital to give a health talk to population of about 50 or 60 people who were all above 50 years of age or 60 years of age. And, I just randomly asked them, how many of you have diabetes? How many of you have hypertension, heart disease, cancers, and all that? And most of them were suffering from something or other. And I'm like, how many of you eat meats regularly? And just two or three of them raised their hands. And how regularly do you eat? Approximate once a week, like on a Sunday or something like that, like a feast or a special day. And that's about it. And then went ahead and gave them a talk on nutrition and the nutrition science, and they were quite sad. They were like, nobody's ever told us anything regarding this, how this could change our lives. And they always thought that they were eating healthy. Clearly they were not, and they were actually receptive to it. Usually the older population are like mostly resigned to their fates, that we've lived our lives, and we'll continue the way we are. But most of them wanted to get off their medication, so they understood this part. And then after that, they were taken for a tour to a temple where they were given somebody preached them about veganism and vegetarianism, and some of them actually asked them, this is what we eat till now, and we're still suffering from a lot of other things. And it was an interesting day for them, because it started off with carnivore and ended with veganism. But yes, a lot of people are actually starting to think, and they're trying to understand what we're talking about. Even if they can't go fully carnivore, at least go low carb and increase your meats. It should help them for sure. And it'll cut down costs 100%.
Yeah, I mean, there is, as you probably are aware, more so than I am, there is a population of folks in India that are doing carnivore. I know many
Yeah.
of them, and some of them. And one fella, his name is BNS. He has I think, a YouTube channel of 500,000 or so, or something like
Yeah.
that. So I know there's people that have an interest in that. Do you see? I mean, and there are obviously different, religious sort of restrictions around diet and different population, groups. Do we see differences in like general regions where they eat more meat here versus here, that we see different health conditions emerging?
So I don't think there's a differentiation between the health conditions, because, like I mentioned, even if people are eating meats, they're loading it with carbohydrates,
Mm.
a huge amount. And so we've got we've got the Far East, the Northeast, where there's a lot of pork that is eaten. Even in the north of India, there's a lot of pork that's eaten. If you go south, Goa and below, there's a lot of beef. A couple of states have no meats at all. Where I stay in New Delhi, so we get a lot of lamb, seafood, eggs, chicken, mutton, pork. All of that is available. Buff meat is really going up right now, because a lot of people are understanding steaks and stuff. So we're getting ribeyes and tenderloins and sirloins, but that's buffalo meat, not beef, which is still okay, because that's also quite nutrient dense. And we get organs also. So in the north, chicken organs and mutton organs. So that's there. But health wise, there's not much of a difference, because even down south, if people are eating a lot of red meat and beef, again, it's going to be like maybe twice or thrice a week or something like that, and loaded with carbohydrates, and it might just be just one meal in a day. The rest is all plant based. So if you'll go anywhere around, you'll actually look at ill health walking around.
Now, you pointed out that, you've had diagnosis of diabetes, in India for hundreds of years now. It's, documented. And some people would, and obviously the high carbohydrate grain-based diet has been around for quite some time as well, I would assume. Some people would say there's nothing wrong with carbs. It's all seed oils. And certainly I think there has been a transition from more ghee-based cooking to maybe palm oil and perhaps some other oils. And that probably hasn't helped any. But what has been the situation with the cooking fats? And is there a transition away from ghee and more of the traditional fats to more of these processed, ultra processed fats?
So I think in families that still have the older generation, the living older generation, they still use a lot of ghees. They still believe in that saturated fat. right? I was just going through some dietary advices from some hospitals which, when they give it off to the patients, and they've come from the propaganda school, and they actually document foods to be moderately eaten, includes the refined oils. It says refined oils, soy, canola, and sunflower oil. So the dietitians are actually prescribing the seed oils, but the older generation still has a lot of ghee, still has a lot of coconut oil, and some mustard oil, which is omega 9s, erucic acid. I'm not sure that there's too much of research into that, but we've been using that for many years and generations, and it looks to be absolutely safe. So yeah, I mean, at least in my household, my wife makes her own ghee, and we use that for cooking, and it's still used in a lot of places. But yeah, again, people are going with some of the brands which just claim to be heart healthy and stuff. The dietitians are also not actually recognizing the harm of the seed oils actually.
Yeah, there's something I think it's called jaggery or something like that, which is kind of a sugar which I don't think we have much in the U.S. or maybe some
Yeah.
specialty places that have it. What is some thought? Is it like it's a healthier sugar or something? What is the story on that?
It's like how people call, probably honey as a healthy sugar. It's the same thing with jaggery. It's just a little less processed than the white sugars, a little raw form, but it has the same effect. So a lot of people actually, mistake that. Like Robert Lustig has mentioned, 350 different types of sugars, which can harm you, and jaggery is one of them. So it's been there for a long time. I think earlier people used to probably have it maybe just a little bit, like a celebration or something like that. But now people have started using it as a substitute, not understanding that it can still harm you.
So back to your initial experience, when you said you had been low carb and then you transitioned more to a carnivorous diet. When did you notice this was something that was maybe different, and what kind of, did you notice any major like satiety, hunger, inflammation? I mean, obviously you lost, you said like, I think you said something like 20 kilos or something like that, which is quite a bit. When did you start to notice that? And then did that cause you to shift your thinking once you started noticing it yourself?
Yeah, absolutely. I mean, first of all, I noticed a lot of inflammation from my face going off. I became a little leaner, and it was not just me. I had my team who would tell me, you're looking different, you're looking younger, you're looking better. So like, okay, fine, I'm on to something. And then I figured I was getting leaner. I was getting more lean muscle than what I had before. My heartburns and my dyspepsia absolutely disappeared. I had a bout of esophagitis before this, which did not recur. And I used to have PPIs almost every day, proton pump inhibitors every night after dinner, and I don't need to do that anymore. And this happened in probably about 2 or 3 months of going carnivore, because and I used to have PPIs because I used to think that's the way of life. I've hit 35 or whatever, and I'm supposed to get dyspepsia now, and we need to have these proton pump inhibitors after dinner every night, and then probably will become hypertensive later and diabetes later and all of that. But thankfully that hasn't happened. So yeah, my heartburns, acid reflux, all of that went down. I noticed that my muscle soreness after workouts, came down to like probably 1 or 2%. So yeah, I used to feel less inflamed after my workouts. My bladder control, for sure, that was something that my wife and I noticed. Both of us together. I mean, whenever we used to go out or something, having a drink or something, we would have to rush to the bathroom, and the control was not very, top notch. But then just one fine day, I was like, you know what? I don't feel the need to rush to the washroom anymore. It was just like that. And where I was really surprised. My sleep's gotten better, my libido's better. All of these changes have happened. I used to get some skin infections earlier, which have disappeared. I've had toe fungus, which happened, and this toe fungus actually happened when I was doing low carb. But in low carb, I used to have a lot of oats every day, every morning, thinking that's good for me. And once I cut that off, a lot of my symptoms disappeared. And when I was having oats, I used to have my TM joint used to click all the time, which never happened before. Because when I went low carb, I started having oats every day, and this is when it started. And I showed it to my oral surgeons and all. They couldn't figure out what was happening. I didn't get any scans done. But then when I went full on carnivore and I left the oats. In 1 month, these symptoms absolutely disappeared. So, lot of these changes have happened. Yeah.
You'd mentioned, you're 35-ish, and all of a sudden you're expected to have reflux and dyspepsia and all that. Well, I mean, what is the? I mean, what is the expectation for aging in India? Let's say, you know, 25 to 50. I mean, are you expected to decay, or is that what everybody sees? What is it like to age in India?
Yeah, I mean, a lot of people actually, when we're discussing things, they're like, I don't want to grow old and die. I don't want to be on a bed when I die. I don't want to die of diseases. I'd rather, have a good time and die off early. And that's become a normal notion for everybody, thinking, once you hit a certain number, you're going to start getting symptoms. You're going to start needing medications. Because nobody talks about nutrition. Nobody talks about how you don't actually need this. And we've got the healthcare system. We've got private hospitals, corporate hospitals, tertiary care, secondary care, primary cares. Everything is there, and people actually think that this is the normal course of life. That you're going to get dyspepsia, then you might become hypertensive, you might become diabetic, you might get some arthritis later on in life. You might get dementia that's really on the uprise right now. You might get some kind of a cancer. And the thing is, I've seen two types of people over here. One who think nothing's going to happen to them, so they continue with their lifestyle and they do not get tested anytime. And the other one who do not get tested, just fearing the fact, what if something comes out, and both of them actually suffer. We've had so many patients coming in at 30, 35 with sudden cardiac deaths, and the family comes in asking us questions. Why would this happen? This guy was healthy, and then we discuss with them that, how do you know he was healthy? He just looked healthy. He looked thin. Doesn't mean that he was healthy from inside. Did he ever get tested? No. What was his diet? This was his diet. So, I mean, we tell them these changes could have happened, or these are the things that could have gone wrong, but we can't do anything about it right now. So, yeah, I mean, we're trying to raise awareness regarding that again. So, yeah.
How much influence, like in the US, the pharmaceutical industry is, I mean, they're just married to the medical system. I mean, they're just so tight. I mean, they control the education system. They fund a lot of the training programs. Most of our physician continuing medical education is paid for by the pharmaceutical companies. They constantly are in physicians' offices, influencing physicians. Is it similar in India, where you have a big pharmaceutical presence there?
We've got a presence, but something that I really like is, and this is unlike the US, no pharmaceuticals can, show advertisements regarding their medications. Not on billboards, not on televisions, not on the radio, nowhere. Nowhere can pharmaceuticals give their ads, except for probably in conferences. That's about it, where when they get a stall or something like that. That's a different thing. But they cannot influence the general public with their ads on television or radio or any other media. That's something that's really, really good. There are some really strong guidelines. They do visit to the hospitals. They do, provide with the leaflets and the pamphlets for probably drug recall, because there's so many brands going around. So that happens. And our curriculums are the same as US or the UK. So whoever's written the first one, it's come down to us anyways. So I mean, it has been adopted from the international authors also. So uh, they don't have a direct influence on us, for sure.
Let me ask you, you're probably aware in the U.S., we had an election and we've got this Make America Healthy Again movement, which is gathering speed. And, we're kind of figuring out if Robert Kennedy's going to be confirmed, and that may have different impacts. But has that had an impact in India? Is there some sort of Make India Healthy Again sort of
I,
movement that's going on in association with that?
I really wish that it happens. I've been thinking about making the world healthy again, but everybody's going to start from their own countries, I guess. We're having a metabolic health conference soon, I think next month, which is a virtual event. I think you've been on one of them. I'm not sure. Maybe last year, maybe before that. Yeah. So, probably we'll talk about that in the conference. And yeah, but again, the media is not picking this up that's a problem. Today itself, I think 10 different people from my social circle sent me that stupid case report from JAMA about the guy leaking fat from his hands because his
Yeah,
cholesterol
yeah,
level went
yeah.
up on a carnivore diet, right? And they've all been sending me something from the Indian media that picked it up, right? And I've been telling them that they haven't read the paper properly. The paper is not written properly. It's a really bad one. Mind you, go through my content where I've told people that my patients have normal cholesterol levels and they're getting heart attacks. Forget about leaking fat and xanthal asthma. But so again, it's propaganda for sure. It's very difficult for us to get into the mainstream media like anywhere else. Till that doesn't happen, I think it's going to be difficult. But yeah, we're trying. All of us are trying.
Yeah, it's interesting how they run with this sort of case report of the xanthal asthma, and then they forget to mention that xanthal asthma is not associated with heart disease. It has no relationship to there. It can associate with high cholesterol, but that doesn't independently associate with heart disease. And yet there have been a number of papers published on the positive benefits of carnivore, and it's crickets. No one picks it up. It's like, we don't want to talk about that because it's not in our agenda. So it's obviously, you see that very much the biased agendas that are out there. And, this paper that was written it was a 150-word blurb with no information. It was like, we have this is it's and of course every headline wants to pick it up because they want to sort of continue with the narrative. Obviously, you'd mentioned there's a lot of meat in India, and most people don't realize that you guys have the biggest cattle herd in the world. I mean, you've got 300 million head of cattle, 200 million cows, and 100 million buffalo. And there's actually about 39 million slaughtered every year, more than the United States. Most people don't realize that India is one of the biggest places. And, some of it most of the stuff locally I think there's a prohibition from exporting slaughtered beef in India. Correct me if I'm wrong. But still, obviously you've got 5 times as many people as we have here, close to that. That's what I was going to say. Is there a big concern around climate and diet there? Are they talking about you should only eat plants because it's going to save the planet from global warming or something like that? I mean, I know a lot of people are critical of some of the India, China, big countries, lots of pollution, and are like, well, why are we going to eat salad when everybody else is still polluting? What is the thought around climate issues there?
So I've seen only the educated ones actually talk about climate, but most of them are not, trying to relate that to meat consumption. I mean, we've had a few articles coming in where, farmers from the state of Punjab have actually come out and said, our monocropping has actually destroyed our lands because they only grow rice over there. And they've lost the ecosystem in the last 20 years. They've not seen any butterflies, caterpillars, earthworms, and in the fields that they used to have. Again, there was another one which said that the percentage of arsenic increased by about 100 or 1,000% or something like that. I'm not getting the numbers right, but in the rice that was cultivated, across India. So, yeah, people are talking about how it's destroying ecosystems, but not too many people are talking about animals or cattle and herd leading to global warming. I think they're smarter than that.
You mentioned, and I think this is interesting, and maybe you're aware of this, rice consumption. Because a lot of people will say, well, look at all these folks in Asia. They're all skinny and ate all this rice. But the data I've seen shows that rice consumption, actually, if it's in high amounts, positively correlates with diabetes. Do you see that as a contributing factor to problems?
Yeah, absolutely. Yeah, most of the population eats rice. Like I mentioned, your breakfast starts with a lot of rice products, and the Indian population is not skinny. I don't know why people think that in the Indian population is skinny. They're not. Everybody's got a midriff. Everybody's got a pot belly. So not skinny at all. I mean, that would be an exception.
Yeah, I mean, skinny by American standards. You have to
No,
think
but
it's
we've seen
irrelevant.
we've,
But yeah.
we've seen our share of 150 200 kilo patients coming in. Yeah, but not as much as the Americans. You're right. Yeah, I've been there.
Yeah. What is, because how, as an ER physician, do you work, like 12 shifts a month or some, I mean, I don't know what the
So I,
sort
I
of
do I do 9 to 5 Monday to Saturdays,
9 to 5 Monday
eight,
through Saturdays.
8 hours a
Okay.
week.
So 8. Okay. So, and your typical day, what does a typical day look like for you in the ER?
So yeah, I have my breakfast, go to work, you know, see patients, teach my residents, academics, do some research, save some lives, maybe lose some, come back, do my workouts. So I do my workouts thrice a week, Monday, Wednesdays, and Fridays. And then if I have a podcast, I do a podcast on Tuesdays, Thursdays, and Saturdays. I do my own podcast, which is called DESI Project. So yeah, I started that off 3 years back. So yeah, I get guests on. Like it started off as a pure emergency medicine podcast, but since I've realized emergency medicine and metabolic health of the society go hand in hand, uh, I've got a lot of guests the whole of last year, and I'm going to get you hopefully soon. I've been trying
Sure.
to get.
Be
I've
happy
been
to,
trying to
of
get you
course.
to.
Yeah.
So yeah, so Tuesdays, Thursdays, and Saturdays are my recording days. If there's somebody in Australia, then I do Sundays because the timings are match for us. So yeah, that's my typical day. I come back home, yeah, do my workouts, play with my son, have some carnivore meals with the family. My sleep is so much better than before, for sure, 100%. So yeah, I mean that's my typical day. Sundays, no workouts, do some sports or just relax.
With regard to your day, as far as in the ER, I mean, I guess I'm trying to ask, like, what are the patients you see in it? What would a day of ER patients look
Uh,
like? What kind of stuff are you going to see on a typical day?
Let me see. So, last week was a really quiet week. We hardly got any patients. And, compared to that, this week has been complete madness. So, ER is the most dynamic department of the hospital. I mean, if there's calm, there's going to be a storm that's coming, right? So we had a few major traumas come in. We had some heart attacks coming in. We had a couple of strokes that came in. We had some pregnancy complications that came in. We get a lot of kidney disease patients. So, we dialyze them in the emergency itself. So a lot of kidney disease coming in. We put them, put the hemodialysis catheters and get them dialyzed. So,
And just let me interrupt you here. And those kidney patients, they're all on real high protein diets because high protein kills their kidneys. Is that what you're saying, or no?
no, no, not at all, not at all. They're pure vegetarians. Most of them are pure vegetarians. They already have diabetes and hypertension, and that's what's destroying the kidneys. And yeah, I've had some discussions. I remember a patient who was a pure vegetarian, and I asked him, what do you eat? And he said, I eat healthy vegetarian food. And I'm like, but you're on 13 medications. If you're on 13 medications, something is actually wrong with what you're eating. Why don't you try and get some meats into your diet? And unfortunately, he was a religious person. No offense to anybody, but I mean, he was like, I'd rather die than eat meats. I'm like, all right, man, choose this.
Let me just at the beginning, you mentioned you're collecting a series of patients. I think was it 7,000 or something like that, where you said they were diabetics and 66% were pure vegetarians, and the remaining ate meat very infrequently, like a couple times a month. Is that
Yeah,
what you told me?
yeah, yeah. So we're going to collect this data till December of 2025. So we'll have quite a big N number.
Okay. And then you plan on publishing, I assume. Is that correct?
Yeah, that is the plan. Let's see if it works out.
Yeah, I'm wondering. I mean, I'm wondering what journals you're trying to publish in. Are they Indian journals? Are they international journals? Where are you
So
getting the resistance from?
international ones for sure. So I've tried some emergency medicine journals. I've tried some internal medicine journals. I tried Frontiers in Nutrition and all, but the publishing charges are really really high. So for that I'll need funding if I have to publish over there. So I haven't sent it to them. But most even if it's subscription based, that's fine because they don't have any APCs then. So yeah, I mean we've just started off our journey into publishing our metabolic health and emergency medicine papers. So, I mean, we've already published like about 40 different papers. We've done RCTs and prospective observational and a lot of other ones which are all related to emergency medicine. So we've published 40 papers till now. And now we're getting into this space. So let's see how it works out. I mean, we just had a couple of papers which I've sent, and they've been rejected not because the reviewers had a problem, but because the journals couldn't find reviewers who wanted to review those papers. So we're still looking into it.
It's interesting. The reviewers don't want to review it. What is it? Are they saying it's out of their expertise, or they don't like the subject matter? I wonder. You probably don't get any
Yeah,
feedback on that.
that's not told to us.
Well, good luck with that. And if you do get something published in this area, certainly share it with me, and I'll make sure it gets as much exposure as I can get it, because I think this is interesting stuff. And I think you're going to make a huge difference in a country where, as you're probably aware of it as much as anyone, there's a lot of improvement that could be made. You got all these people walking around that are metabolic disasters, and the solution is not that hard in my view.
Yeah, absolutely. Thank you so much, Shawn.
Well, Ankur, Dr. Verma, thank you for being here. Unfortunately, I got to go. Tell me your social media, so if anybody maybe wants to follow you, or any from India that might be listening might want to, because do you speak primarily in English, or do you speak in
I do
languages?
English. I do English and Hindi,
Okay.
but yeah. So my Instagram is the carnivore.ep. EP stands for emergency physician. My X account is ANKSV25. And people can follow my podcast also. It's called the DESI Project. It's on Spotify and Apple Podcasts. So people can find me there. Yeah.
All
And
right.
I hope to see you there too.
Thank you for doing. Yeah, I'll be happy. Just let me reach out to me, and I will make it happen. All right. Thanks so much. Appreciate it.
Thank you so much.